Okie dokie class, time for the next lecture. So we will start with tissues and then move on to the integumentary system, which is also known as the skin. So if you look at the four main classes of tissues, we have epithelial, connective, nervous, and the muscular. We'll start off with the epithelial. And if you look at the definition, it's composed of layers of closely packed cells that cover organ surfaces or form glands. They serve to protect, secrete, and absorb. So where are these found? So epithelial are usually found in the linings of the digestive tract, in your mouth, esophagus. So they're really there to protect the layers of the epithelial tissue, whether it's simple, meaning one layer, or stratified, which means multiple layers, will pretty much determine what their function is. And I'll explain that in the next few slides. Connective tissue is tissue with usually more matrix than cell volume, often specialized to support, bind, and protect organs. So those are our tendons and ligaments, cartilage, bone, blood. Yes, blood is connective tissue, and lymph. Nervous is tissues containing excitable cells specialized for rapid transmission of information to other cells. That's our brain, spinal cord, and nerves. And then, of course, the muscular tissue is composed of elongated excitable cells specialized for contraction. So we have skeletal cells, skeletal muscles, we have the heart, and then we have smooth muscle. We'll go into nervous and muscular a little bit later when we actually do the nervous system and the muscular system. Today we'll focus on the epithelial tissue. So you have simple squamous epithelium, which are found in the air sacs of lungs, kidney tubules, serous membranes of stomach and intestines. And what's the purpose? So when you study this, you want to know, okay, what's the name? Simple squamous. Simple meaning one layer. Squamous being square shaped. And it allows for rapid diffusion or transport of substances. So you can see by just having one layer, you can easily transport substances back and forth. And you're like, okay, well, that makes sense. Well, the lungs and the kidneys need something that's simple like this to transport material back and forth. So all these tissues have a purpose. You don't want to just arbitrarily just memorize simple squamous, kidneys. You want to think about, well, why is that tissue simple? Why is it thick? Why is it the shape that it needs to be? Because then you'll understand the material a lot better. If we look at simple cuboidal, now this is simple meaning one layer, cuboidal meaning cube shaped, okay, or square, and they allow for absorption and secretion. Where are they found? Salivary glands, kidney tubules, mammary glands, thyroid, and liver. Okay, so you again memorize the name, of course, what it does, and where it's found. Simple columnar, simple meaning one layer, columnar meaning column shape, so more rectangular, and those are found in the stomach, the intestines, the gallbladder, and the uterus. And it allows for absorption, and it also secretes mucus. Remember in class I was telling you that the mucosal lining helps protect our stomach. In lab, you're going to have to identify these in a microscope, but for lecture, you want to know the name, what it does, and the location in the body. Pseudostratified ciliated columnar is one of my favorite tissues. It's found in the respiratory tract, the male urethra, but it allows for secretion and propels mucus. The example I gave you in class is these little cilia. What they do is we call it the mucociliary elevator, and every morning when you wake up, it takes the mucus out, and when you brush your teeth, you get a little bit of mucus that comes out. That's perfectly normal. If it's clear to slightly yellow, that's perfectly normal. We just don't like Christmas colors coming out of you, right? You don't want green mucus, you don't want red mucus, because that could indicate some kind of pathology. And if you have a family member that smokes, what happens is the tar and the nicotine, they paralyze utilize these little cilia. So when these cilia can't take the mucus out, you get something called the smoker's cough. So it's that dry, hacking cough. They're like, ah, ah, ah. They're trying to clear their lungs, but because the nicotine and the tar have paralyzed them, they can't clear their lungs. So they're more susceptible to COVID or respiratory illnesses because they can't clear their lungs. So the lesson of the day is don't smoke. Cigarettes or marijuana, all that stuff is bad. Okay, vaping, hookah, all that crap. As soon as you light something up, it produces tar and it's bad for your lungs. No, regardless of what people tell you. If you look at stratified, now we move on to stratified. If you look at this one is called pseudo-stratified. Pseudo means fake and stratified means multiple layers. So if you actually look at this, it kind of gives you the sense that there's a whole bunch of layers, but it's really not organized really well. So it's pseudo-stratified. But if you look at pure or real stratified squamous, stratified meaning multiple layers. Look at all these layers. Boom, 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 boom. Look at all these layers. And squamous meaning square shaped or flat shaped. Okay, so here it is. But whereas that keratinized means that it's only found in the epidermis, the palms, and the soles of your feet because it resists abrasion, it retards water loss, and it resists penetration of organisms. So you definitely, if you've ever gotten callus on your hands or on your feet, what happens is the stratified squamous builds up a callus right here. It's trying to protect your heel or trying to protect your hands, meaning if you get a lot of friction, it's going to lay down more layers to protect it. Okay. But if you ever see a patient that has heels that are cracked, well, now you open the path for organisms to come in and they can get an infection and it's hard to treat. So you definitely want to take care of, make sure you use moisturizer and cover up when you're exposed to the elements. Okay. Stratified squamous epithelium, non-keratinized, is found inside. So that's found in your tongue, and it's found in your esophagus, anal canal, and vagina. And again, the same thing as stratified squamous, it resists abrasion and prevents pathogenic organisms from entering. So the example I gave you in class is, let's say you ate a tortilla chip or a Doritos and it's real sharp, right? And you forgot to chew and then you feel it. You're like, it's cutting the inside. Luckily, you have stratified squamous, which are multiple layers designed to protect you so that you don't bleed from the inside. It's there to protect you. Okay, so you want to be very careful. Make sure you chew your chips real well. But I've had that a couple times where I was just in a rush, so hungry, eating salsa and chips, boom, boom, and you're like, oh great, here it goes, and you just feel it until it gets all the way down to your stomach, and then the hydrochloric acid will dissolve it. But during that time, you're just like, oh my gosh, it hurts like heck, right? But luckily, you have stratified squamous that will protect you. See, again, the whole purpose of what I'm trying to tell you is try to relate it to real life. What's the purpose of these tissues versus just arbitrarily making flashcards and rote memorization? Try to relate it to patient care or try to relate it to your real life and make a story behind it so that you remember the material. The anatomy is pure memorization. But if you can put some kind of relationship to it, then when it comes to the test or when it comes to, you'll be like, oh yeah, I remember the Doritos little story that he told me, stratified squamous, boom. Okay, so that's what and you don't have to use my stories. You can make your own stories. Now, transitional epithelium is found in the urinary tract. It protects tissue from osmotic and acid effects of urine and stretches to hold more pee. Okay, so the urinary bladder is capable of holding about 500 cc's of urine, but around 250 you start doing the pee-pee dance and say, hey, I better go to the bathroom. But it does stretch to a certain point. Okay. All right.